to follow the rules. Again, the only problem is they're finding that the evidence that apparently this was all based on is either unavailable or wasn't kept, or they're not willing to share it. You may recall a few years ago that we had this virus going around, and our medical officers and our politicians enacted a number of different measures that really changed our lives. They, in some cases, cordoned off playgrounds, they shut down schools, they closed certain businesses, they required certain documentation in order to travel. It was really disruptive, to say the least. But during that time, we were reassured that people were following the science and that these were evidence-based decisions. Only now, several years after the fact, a few other things are coming to light. And you probably haven't heard of this story because it was buried fairly deep on the CBC's news page. But recently, the Auditor General in New Brunswick was doing an audit of a number of different measures, including the public health policies and the decision-making around them. And part of what he asked for his report was that the health department provide the backup evidence or the documentation on which they based a number of their recommendations over COVID. And surprisingly, the health department was not able to provide any evidence. Now, just to refresh your memory, and I know it's kind of hard because we are going back a few years, and I want to share a quick video here of just a little bit about what was going on in New Brunswick during COVID. So this is the Chief Medical Officer of Health for New Brunswick. Her name is Dr. Jennifer Russell. Now, interestingly, just last week she resigned her position, and this was just before the Auditor General released his report. She's now going to be working for the University of New Brunswick, I believe. But she was the Chief Medical Officer for New Brunswick during the pandemic and up until just about a week ago. So I certainly won't play this whole video, but I just want to sort of remind ourselves of just what some of the rhetoric was like during the pandemic.
In New Brunswick, the COVID-19 virus is spreading primarily among the unvaccinated, and more than 85% of new cases reported over the last 2 months have been in those who have not received their full dose of a COVID-19 vaccine. The vast majority of those who experience severe illness are unvaccinated, and again, we've said those numbers throughout the pandemic when we received the data on the efficacy and how effective the vaccines are. Up to 95% will be protected from severe illness and outcomes with a vaccine, with their 2 doses.
Remember the 95% effective rate? It's going way back.
Ask that you put your community first, your family, your friends, your loved ones, this entire province, our healthcare workers. I ask that you take action to protect those who cannot protect themselves.
Yeah, remember and it was an impassioned appeal to protect our loved ones, to protect the vulnerable, to do the right thing. It was definitely coded as a moral virtue in order to get vaccinated, to follow the rules. Again, the only problem is they're finding that the evidence that apparently this was all based on is either unavailable or wasn't kept, or they're not willing to share it. It wasn't just, in fairness, these medical officers of health, it was our politicians as well. And I'm reminded, like in New Brunswick, under Blaine Higgs, he happens to be a conservative. This was something that both conservative and liberal, and I suppose NDP provincial governments were doing. And certainly our federal liberal government took a very hard stand on COVID. You'll remember our Prime Minister talking about the importance of getting vaccinated and not going on a plane or a train next to someone who's done the right thing. Anyway, I'll just remind you of what some of the politicians were saying as well. And it's interesting here that this is Premier Blaine Higgs, and I'm not sure if it's right in this clip exactly, but throughout this he is strongly suggesting that these policies are designed to, he doesn't use the word coerce, but it's pretty clear that he talks about making people's lives more difficult to guide them to make a medical decision, not because they believe in the medical efficacy, which many people did and others didn't, but out of convenience. So I'm not sure if the reporter's question's coming through there. The reporter is basically asking, what are you going to do, Mr. Premier, if these policies come up against resistance from the public?
The sad part about this is that what we're trying to do here is make it an encouragement for those that are unvaccinated. And if I say, if I look at 87% that have a single dose, it just begs the question, why wouldn't you get the second dose? When we get up into this 85 and 90% range, we wouldn't be having this problem if we're at that level with 2 doses. So it's like, has there been a reason? Well, if your daily routine is impacted, then we're hoping that's enough reason for someone to say, okay, well, I'll get my second dose.
If your daily routine is impacted, we hope that's enough for you to get your second dose. I'll just play one other thing here. This is something that I sort of forgot about. COVID was so crazy on so many levels, and when we were in it, everything seemed crazy. I sort of forget just some of what was going on. Like in New Brunswick, and I think the other Atlantic provinces as well, or the maritime provinces anyway. Newfoundland, I guess, being an island, didn't have to do this so much, but they actually restricted travel from outside of the province into the province in some cases, if I recall correctly. And Premier Higgs talks a little bit about that here.
That are allowed under public health regulation to protect the general health of the public, which certainly gives us the right to enforce those rules. But border checks would require us being back in emergency order, which...
And border checks, just so we're clear, I don't believe he's talking about international border checks, but he's talking about provincial border check, preventing all those infected people coming in from Quebec or Nova Scotia, one presumes.
If necessary, we will go there. But at this stage, it's going to be based on, if you want to move around our province, your ability to do so, not being fully vaccinated, will indeed be restricted.
Okay, so restrictions, just to give you a little bit of a refresher of, I guess, what we've been hearing from. Now, this Auditor General, his name is Paul Martin, not the same Paul Martin who used to be our finance minister and prime minister there for a little bit, unless he got major surgery done. This is presumably a different Paul Martin. But anyway, he's the Auditor General of New Brunswick, and he recently published this report. It's actually in 3 volumes. So volume 1 was published, I think, back in November, if I understood correctly. Volumes 2 and 3 perhaps came out just the other day. I noticed this yesterday as I record this. And the report, I mean, it covers a number of different things. Some of them have to do with COVID, but it's not necessarily a COVID investigation exactly, although it does sound like the Legislative Assembly did want him to look at least some parts of COVID. So this part here, Chapter 4, the Pandemic Response, Department of Health. And this is, I find, interesting. I guess there's a few things here. Chapter highlights, let me have a look here. I'm kind of going a little bit of a diversion here, but I find this kind of interesting, the way it is worded. Let me just see if I can find it here. Okay, the audit objective. And just notice the language here. I mentioned this because to me, and again, I don't know this Auditor General, I don't know New Brunswick politics very well, but the tone of this seems like, if anything, a fairly government-friendly audit. And when we see his testimony, the Conservatives, the government in New Brunswick, seem to sort of treat him as a friendly person. Anyway, so the audit objective, the objective of this audit was to determine if the Department of Health had systems and procedures in place to effectively reduce the spread of COVID-19. So did it have measures in place to reduce the spread? And listen to this, the slight language change in the conclusion. Conclusion, the department and RHA, that is, I think, regional health associations, went above and beyond to support New Brunswickers during the COVID-19 pandemic. They tried really hard, I think is what he's saying. There are stories of numerous staff consistently stepping up in the navigation of these unprecedented times. Fair enough. It was hard for a lot of people, and credit where credit is due. I think he's just recognizing that a lot of the frontline workers certainly went above and beyond, and I don't dispute that at all. And then the second part here, 4.12, our audit work has concluded that the department had numerous systems and procedures designed to reduce the spread of COVID-19. Sorry, what was that? They reduced the spread? No, they had procedures designed to reduce the spread. Did those procedures reduce the spread? Well, we're not saying, but they were designed to do that. But anyway, it seems like it seems kind of friendly. But anyway, the part that I find most interesting here is this part here. So here, and it's technically 2 sentences long, our office selected a sample of 33 OCMOH, that stands for Office of the Chief Medical Officer. So it selected a sample of 33 recommendations and asked the department to provide evidence-based documentation to substantiate the decisions. So you'll recall during the pandemic, these medical officers of health would talk about following the science and that they're doing evidence-based science. And the medical officer herself, Dr. Russell, she talks about how she's doing things based on science. But the funny thing is the department was unable to provide requested documentation, acknowledging that they, quote, did not create a compendium or repository of all the scientific articles, papers, publications, and analysis it consulted during the pandemic, and therefore we cannot provide a fulsome and detailed list of all the evidence consulted and used when recommendations were being formulated. So I'm not sure how many actual recommendations the Chief Medical Officer of Health made in New Brunswick over the course of the pandemic. Clearly it's at least 33. I imagine it's maybe, I'm not sure if it's hundreds, it might have been, I don't know, but certainly several tens of them. And now they don't even go into the procedure. They don't talk about how they selected those 33. They don't talk about like how many recommendations there were, like were there 1,000 recommendations and they randomly picked 33? Were there 100 and they picked 33? They don't say. And what's also strange is the statement from the health department to their own Auditor General. So this isn't a reporter or some opposition party. This is someone who's like a bureaucrat who's hired to check in on the workings of government. And it seems to me that they didn't provide any evidence for any of the 33. It's not as though he said, well, there was incomplete evidence or they were able to provide it in some places and not others. It sounds like it's just a complete denial of the request. They don't say, well, there's this talk about a repository as though, the only way that they could rely on it is had they been able to make a repository. Like surely there's a chart or a graph or a slide deck somewhere or some scientific papers that they relied on, but they don't seem to want to produce them, which is strange. And it's also strange that the Auditor General doesn't have anything other much to say about it. It's just this one, this paragraph, which is technically 2 sentences, and then the recommendation is, well, we recommend that the Department of Health ensure the development and retention of adequate documentation to substantiate public health measures. And again, these were not little recommendations that affected how a bandage dispenser is mounted in a hospital or things like that. This was lockdowns and school closures and vaccine passports and mask mandates and et cetera, et cetera. These are all recommendations that came from the Chief Medical Officer of Health that affected government policy, and oopsie daisy, we don't seem to have it. I guess we wrote down our scientific information on a napkin here and someone misplaced it, and a few years have passed and oh well, I guess we can't provide that information. It seems pretty ridiculous to me. I want to show you just a little bit of testimony from the Chief Medical Officer of Health. So this is back in November of this year, so fairly recently.
But when you say that a statement was provided, the statement was always provided with the help of all of our subject matter experts and our public health team. So it was all evidence-based information and up-to-date information. So there were no questions that weren't answered. There was no information that wasn't provided. And again, if it was necessary to have an interview in public or a press conference, that was available. So it was done on a triage, on the basis of how we were triaging the requests. Voice of public health has to be managed in terms of we need to make sure that it's at the same level that's appropriate for whatever risk that we deem. And so we are the ones that are the experts in risk assessment. And so when we feel that it is necessary to communicate in a certain way, a certain message, that is what we will do. But we take into account that you can't overdo it. You can't elevate the risk of something in terms of speaking about something in a way that then detracts from something that might be more serious in the future. So we take that very seriously, the weight of the comments and how the comments are made and delivered, whether it's in print or in a press conference or in an interview. And again, no decisions were made without an all of society lens. And so what we do know from negative impacts and unintended consequences in terms of there's actually scales. You can actually look at evidence-based scales of this restriction causes the R factor to drop by this much, but these are the negative impacts that it has. This measure causes the R factor to drop by this much, but these are the negative.
So just in case you're missing some context, again, I listened to a lot more of this than I'm sharing here, but she's talking about, I found this kind of interesting because she's talking about trade-offs and that certain health policies would have this kind of effect on the spread of the disease, but will have this negative effect. It's funny that she's talking about that because I don't really remember that being, again, I'm not from New Brunswick, but in general, the talk of trade-offs was not in the public debate. It was, this is what we need to do, don't question the science. Politicians were on board, media was on board, the health experts were on board. Anyone who wasn't on board was shut down. So it's interesting that she's talking about trade-offs, which I think is correct. Actually, she says something that I find interesting coming up here. I'll share a few more things here.
In terms of my role right now, as I've mentioned.
So I think she was asked, like, what are the competencies required as a medical officer of health, something to that effect.
And we always have evidence-based information to make our recommendations.
Always have evidence-based, what was that? Information.
Public health measures are being promoted, and we always have evidence-based information to make our recommendations.
We always have evidence-based information to make our health recommendations. Unfortunately, that's not what the Auditor General says. And again, this might seem like a small story. It might seem like old news. COVID is well behind us, and I'm glad. But I think these are important things to look at. We were told something, and I think by and large, most people, I think there's some nefarious actors in COVID for sure. But I think the vast majority of people, and probably this medical officer of health, was probably motivated by good intentions. And I think that was the problem with the whole thing, is people in positions like hers, I think, knew they were lying, or knew they were, lying's maybe a strong word, were sort of fudging things, but in their heart of hearts, they felt, well, we're doing this to motivate people to take action that we think is ultimately good. And I think that's the important part of this difference between governments and government agencies providing information and expertise, but allowing the member of the public, him or herself, to actually make that decision, especially something that is a personal decision or even a moral decision. That it turns out there was no science, at least here in New Brunswick, that can be found. Now, do they have the science and they just lost it? Maybe. It seems kind of odd that they can't produce any of it now. And it also seems odd that, she's resigned her position, and I guess this will be her last committee meeting. I'm not sure if they can subpoena her for future ones. But I think we need to look at this as a society. And the thing that's kind of that, and I've talked about this before, that's really bothersome is back in whatever it was, September of 2021, it should have been our news media who are asking, where's the evidence? What scientific papers exactly? How did you draw this conclusion? But it seemed that our news media, again, maybe they were well intended, but they just joined this thing, this narrative, and became propagandists basically, and began shutting down any kind of dissent. I saw something on, I won't bring it up here, I'll finish up here in a minute, but True North News had an article today that suggests that there's some evidence that Health Canada was actually paying, I think, over $600,000 to a number of online influencers, like quote-unquote independent, like TikTok people, etc., to promote vaccine uptake. And you can think the vaccines are great, but do we really want our government spending taxpayer money to kind of manipulate a message? I mean, it's one thing if they want to buy ad time and say, like, the government of Canada recommends these things, and for more information, talk to your doctor. Yeah, public service messages that's clearly from the government, I mean, that's fine. But this is clearly meant to deceive people by having what appear to be independent people sharing a certain message. Anyway, I know that COVID is behind us, but I think some of the problems in our system, in our government bureaucracy, in our medical system, in our media, these problems still exist, even though COVID has more or less gone away. Again, one last thing, I know I said I'd wrap up, but I did look at some vaccine numbers today, and I noticed that it's much more difficult to get vaccine uptake numbers nowadays than it was. But I did look at some data Canada-wide, and it suggested that, well, first of all, like being totally up to date in vaccines is kind of a confusing thing. There's like a new XBB 1 point something vaccine that I guess is meant to replace all the other ones. So of the people who've taken 1 or 2 doses, it's like 85% of people. But of the people who are up to date as far as Health Canada is concerned, it is only like 15% or 15 point something percent across Canada. So that means that 85% of the people are not technically up to date. Now, I happen to be one of those people who's not up to date, but it's interesting. Where is Justin Trudeau, yelling at them, telling them that they're doing the wrong thing, that their vaccine hesitancy is harming other people? Where is the coercive measures to get these 85% of the people who are not up to speed, over the line? It's not there. And I think the reason for it is because the health people kind of know that it's not reasonable to try to coerce that many people. And I think the politicians know when they see that 85% of the people have not kept up with that. That says that whether people admit it or not, they are not bought into these vaccines. They don't trust their media when it comes to health information. And unfortunately, they don't trust their medical officers of health. And that's disappointing. I want to be able to trust my authorities within reason. I want to check their work, and I want to be able to scrutinize what they say. But ideally, I want people in positions of authority to be worthy of that authority and to be worthy of my trust and the public's trust. I don't take any delight in not being able to trust these authorities. Anyway, tell me what you think. Am I making too much of this? I know COVID is in the past and we've moved on to other things, but are these things important to you? Are they important to our society? Do we need a media that can be as unbiased as possible to report on what's actually going on as opposed to pushing a specific narrative? Let me know what you think in the comments below, and thank you for watching.